All right, so in this video, we're going to be looking at the upper and lower limbs, the arms and the legs. Looking at the arm first, the upper arm bone is called the humerus. The humerus articulates with the scapula on the proximal end and on the distal end with the radius and the ulna, which are the forearm bones. A couple of things here. You can see here the head of the humerus. This has this ball and socket kind of joint, the socket being on the scapula and the ball being on the humerus. And down here, you have these two areas called condyles, and these condyles are these rounded ends. The capitulum is the one that articulates with the radius, and the medial trochlea here, this medial trochlea, you can see the word trochlea, articulates with the ulna. There's a whole lot here. Obviously, you can see we're not getting into a whole lot of this, so we're just going to move on. The forearm is two bones, and these bones are basically parallel. They are the radius and the ulna. They articulate with the humerus and with the wrist bones, and they also articulate with each other. And you can see that here, meaning that they kind of slide past one another on either end. And they are also connected to each other with this membrane called the interosseous membrane, between the bones membrane is what that stands for. The radius is the lateral bone, or the thumb side bone, and the ulna is the medial bone. So it's the bone that is when you hold your hands out in an anatomical position where your thumbs are to the outside. The ulna is the one that is closer to the body. The ulna is longer than the radius, and it forms the elbow. You see this olecranon up here. Basically, if you reach down and feel your elbow, what you are feeling is that the end of that olecranon right there, and it forms your elbow, and the elbow is a hinge joint. We'll talk more about joints later. And you can see it's really narrow down here at this end, but the radius is the opposite. It's narrow up near the elbow and distally widens out. And so the radius actually contributes mostly to the wrist joint. So your wrist is mostly radius, and it works to move the hand. Basically, if you move your hand around and rotate it, when the radius moves that hand, it causes the hand to move, not so much the ulna. Speaking of the hand has lots of bones in it. These bones are called carpals. The carpals are like your wrist bones, and notice they all have names. You don't need to know those. There's just 8 bones, 2 different rows of them. The metacarpals, which are the palm bones, think of your palm, the metacarpals here. There are 5 of them. And then the phalanges, which are the kind of like the ends, and they're called, sometimes you'll see them called the digits as well, these individual pieces. The fingers, and then the thumb. The thumb is typically known as the pollex, which you can't, I don't think the word pollex is on here. I don't see it. No, Pollex, pollex. And it only has 2 bones, 2 of these, whereas the other ones have 3 bones for each of those phalanges. So one imbalance that we can talk about has to do with this thing called carpal tunnel syndrome, which is becoming more and more of an issue. And it's basically this group of nerves, this median nerve, travels through this ligament tunnel here called the carpal tunnel. And this carpal ligament fits over the top of it. Well, that nerve can become compressed through overuse, or it can become inflamed. All these different tendons down here can become inflamed, and this causes tingling and numbness in the hand or on the wrist, and it can be very painful. And you can't have surgery to correct it, but usually the best thing for it is just rest. A lot of times this can come from using a mouse, for instance, too much, or other kinds of actions like that. All right, talking about the leg. The legs their job is to carry the weight when you're standing. So they are subjected to exceptional forces, particularly when you're running and jumping. A lot of the body's force, think of your weight and you multiply that times a certain amount when you're running or jumping. And so the legs are specifically designed to carry that amount of force and then translate that force into the hips and the back. And so we're going to go from the thigh down. The thigh has the femur. The femur is the largest, strongest bone in the body. It makes up about a quarter of a person's height typically. It articulates proximally up here with the acetabulum, member of the acetabulum on the hip bone, and distally down here with the tibia, which is the lower leg bone, and the patella, which is this kneecap. The patella, remember, is a sesamoid bone, and it is found in the quadriceps tendon. The quadriceps are the bones are the muscles of the thigh, and this protects the patella's job is to protect the knee joint and all the ligaments there in the knee joint. And the lower leg is made up of two parallel bones, similar to the forearm, and these are called the tibia and the fibula. The tibia, and these two are also connected with this interosseous membrane, like the forearm bones. They're also articulate with one another as well. The tibia or the fibula does not articulate at all with the femur. That's important. The tibia does most of the weight bearing of the femur and the rest of the body and translates that weight into the foot. And so the fibula is not weight bearing at all, but it does have some muscles that originate on the fibula and is important for stability, but it doesn't at all carry any weight to it. And then lastly is the foot. The foot includes the tarsals, which are your ankle bones, the metatarsals, which are like the most of the meat of your foot, and then the phalanges again, which are like your toes. So the tarsus, there are 7 tarsal bones. The body weight is primarily found or transmitted to the calcaneus, which is the heel bone, and the talus, which the talus is, you can see that right here. And so those 2 bones take up most of the body's weight. You have the metatarsals here, which are very similar to your hand if you want to think about it that way. You have the hallux, Hallux, which is the big toe here, all the way down to the little toe, which doesn't have a fancy name. And then you have this arch that's in the foot. And the arch is important in the foot because and the arch is supported by lots of ligaments, which you don't see. You've probably felt those ligaments if you've ever had something called plantar fasciitis, which is just that ligament is called the plantar fascia. And if it's inflamed, it's called fasciitis. And the reason that you have this arch, if you think about arches are made to support weight. And so the arch of the foot is also for supporting weight. And so a lot of our weight comes down on our feet. And so the arch there protects that. If you've ever experienced any pain in your arch, you know that full well. People who are flat-footed, you've probably heard of someone being flat-footed, may have trouble with this and may have pain in their feet because of the constant support if they're having to support, or they may even have trouble exercising or running because of that.